how to independently, in 5 minutes, without probes, without a spoon, without a jam jar, evacuate mucus from the sinuses if you have sinusitis. Sinusitis? You know you have sinusitis right now. You are 100% sure of this. You feel the pus in the sinuses and there is no medical help nearby. In such a case, you can use this technology. Of course, it's important to remember that if there's a doctor nearby, if there's a chance to see a doctor, it's better to do so and follow the doctor's recommendations. Why does manure accumulate in the sinuses? There are 2 reasons for this. Reason number 1 is that the sinus opening, the little window where the sinus opens, is located at the top. Therefore, for the pus to come out from there, it needs to overcome the force of gravity. And how does this happen normally? To remove mucus or pus from the nasal cavity, we have a mechanism of cilia on our epithelium, the mucous membranes of the nose and nasal sinuses. Microscopic cilia, they lift and remove all the mucus from the sinuses and get rid of it through the nostrils. The first thing that needs to be done is to unblock the nostrils. For this, we use decongestant drops, usually based on xylometazoline or oxymetazoline. We use either drops or sprays.
If we use drops,
we put in 2 to 3 drops according to the following rule. Where we drip, there we tilt the head.
And it's better
to prevent in advance, or to lie down and drip, or to tilt the head strongly. And we tilt our head to the side where we are dripping. If we are dripping into the left nostril, it means we tilt our head strongly back or lie down and tilt to the left. Second condition, there should be a feeling that the drops are flowing inside towards the eye. In this case, the drops will hit the sinus area where the eustachian tube opens. If you use a spray, then the nozzle of the bottle is inside the nose.
You direct
also towards the eye, that
in
which you are squinting. After 15 minutes, the vasoconstrictive drops or spray will take effect. The mucus lining will shrink and the source will start to open up. And we will continue to use the laws of physics. What needs to be done for the pus to start coming out of the abscess? Little window.
The sauce is needed.
Let it down. We know it opens upwards and on the inner wall. So the left sinus opens towards the right eye and vice versa. The right sinus opens towards the left eye. What do we need to do to evacuate the pus from the left sinus? Treat on the other side. So to evacuate the pus from the left sinus, we lie on the right side. Thus our source will be directed downwards. And we can already get the secretion from it. But for this to happen faster, it happened actively because the source is rarely so open like a bottle. And in order to more effectively evacuate the waste from there, it is necessary to,
in the nasal cavity,
create a vacuum. How do we do this? We lay down, and in the position that we just discussed with you, we close with the nose and start to draw air through the nose. That is, as if we are trying to inhale with the nose, but we close the nose at the same time. That is, we do inside the nose. You will feel that a vacuum is created. We hold it for a few seconds and release, and released. Then again and released. Breathe out. We continue this procedure for 2 minutes on each side. 2 minutes cleared one side. You can do more. And if you feel that the mucus is slowly being released, then we went to the sink and rinsed our nose. You can watch a video on how to properly rinse your nose on my channel. There is a corresponding video. We returned, laid on the other side, and cleaned the other nostril in exactly the same way. You can find all the principles of treating acute sinusitis in a special video on how to cure sinusitis on your own at home. You can find it by following the link in the description. And finally, I want to tell you about the peculiarities of this procedure that you learned about today. This vacuum, it intensely affects the mucous membrane and nose, including its blood vessels. Therefore, if after a few such procedures, or after the first such procedure, blood starts to flow from the nose, God forbid, then stop performing this procedure and seek medical help. This complication is rare, but it does occur, so I warn about it just in case. Treat yourself properly and stay healthy. Your Dr. Krabrov.